Hello, today's video is on lower back, hip, and leg pain. I want to talk about the causes, potential causes, the sequence of events that occurs from those causes, and then what you can do about it. So there's only three options for many types of back problems. We have a whole series. This is the first in a series of many conditions. But you have an option as to what you want to do with these problems. There's drugs, there's surgery, and there's therapy. If drugs and surgery is your approach, then this probably won't be for you. But if you believe in therapy, and that doesn't mean just my therapy, there are many different types of therapies, then hopefully you'll take a listen to get a better understanding of why you're having your problem and what you can do about it. So there are three basic causes for lower back, hip, and leg pain. One is physical trauma. You had a fall, you're overweight, your posture is poor, you don't sleep well. Those are physical components. There are emotional components that can create back problems, believe it or not. And that is the stresses of COVID, the stresses of life, even pre-COVID, relationships, finances, work, school, time management. All of those stresses, and we'll talk about that in a minute, create all this tension in your body. And then there are chemical stresses. So we have toxicity in our body. Lactic acid especially builds up in our muscles. So if you have a poor diet, that accentuates the amount of lactic acid in your muscles, which actually makes your muscles even tighter, which makes one more prone to having lower back, hip, and leg problems. So those are potential causes. There are many more, but to keep it somewhat brief, just give you basic information. And then the sequence of events when that stress affects us, that we've just made, those stressors affect us, then there's the sequence of events that occurs. So stress causes contraction. We don't get more relaxed under stress, physical, chemical, or emotional stress. We get tighter. So when muscles get tighter, they actually compromise or compress the joints, the nerves, and the discs in that lower back and hip area, which then affect the leg. Everything that goes on in your leg is controlled by the nerve flow and blood flow that comes out of your lower back. So when we have that tension from posture, from emotional stress, whatever it might be, then that contraction creates that kind of pain or numbness or tingling or burning or achiness or stiffness. So now you have the sequence, the cause, what's occurred, what do you do about it? So therapies that you can go to, chiropractor, acupuncture, massage, yoga, Pilates, things you can do on your own, meditation, rollers, foam rollers, hand rollers, heat, stretching, having better posture, strengthening your core. Be happy to talk to you about any of those. But there are definitely things that you could do, especially during COVID, that people are home. I'm happy to engage in a conversation to help you do the right things. But there's a list of 5 or 6 or 7 things that you could do. Drink more water. Eat healthier foods. It can help your back problem, believe it or not. So I'm here for you. Any questions? Contact us at the provided information below. And I hope you're doing well. Stay safe, stay healthy.